Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Point 8 things to know before your first chemo treatment. Prepare for your first chemo treatment by knowing what side effects to expect, which questions to ask about medications, what to eat before, and more. /r/n/r/n Your care team will discuss your chemotherapy plan in advance, which can help ease your anxiety. /r/n/r/n Here are 8 things to help you through your first chemotherapy treatment. Knowing these tips and the side effects to expect will make you feel more confident and prepared going into your first session. /r/n/r/n Jarratt, CorbisVCG, Getty Imagesrnrn/n/r/n Everychemotherapy infusion includes a mix of drugs. Some are cancer-killing drugs, while others are medications that help ease side effects. /r/n/r/n If you're not already clear about the answers to the following questions, ask your healthcare provider. /r/n/r/n While some infusions take minutes, others take hours. A course may take days or weeks. Ask how you should plan for the treatments that await you. /r/n/r/n You don't have to go to your first chemo appointment alone. There are many reasons to have a chemo buddy with you for this session and future ones. /r/n/r/n First, you might be prescribed medication to take before chemo. Having someone drive you to your session can be helpful if the medication makes you tired. /r/n/r/n Second, bringing a friend or family member means you have someone there who can focus on taking notes on instructions you are given and remembering questions you want to ask. It's easy to become overwhelmed or distracted, particularly when chemo is new to you. /r/n/r/n Third, that person can also help you pass the time, which can be particularly helpful for lengthy treatments. /r/n/r/n Lastly, while you will be monitored throughout your treatment, the team won't have eyes on you the entire time. A chemo buddy can keep a close eye out for reactions, like a rash or facial flushing, and inform healthcare providers immediately should they occur. /r/n/r/n Chemotherapy drugs are very drying to your body's tissues. Becoming dehydrated may cause you to feel worse overall. /r/n/r/n Staying well hydrated can help your body purge waste while reducing the likelihood of problems, such as fatigue and headaches. /r/n/r/n Right after an infusion, it's best to drink 8 ounces of water every hour until bedtime. Avoid caffeine as it can be dehydrating. /r/n/r/n In rare cases, such as severe kidney disease or heart failure, it can be detrimental to drink too much water. Get specific hydration guidance from your oncologist if you have any other serious medical conditions. /r/n/r/n 2 to 3 hours before an infusion, eat a light, high-fiber snack. /r/n/r/n Chemo drugs tend to slow the movement of your digestive tract, peristalsis, so whatever you eat may be in your system for longer than usual. This often causes difficult bowel movements. /r/n/r/n The drugs commonly used to prevent nausea and vomiting due to chemotherapy can also be constipating. Between staying hydrated and eating fiber, you should gain the upper hand on constipation. /r/n/r/n You may also want to purchase foods for after your first treatment. The best foods after chemo are high in protein and calories. These types of food will help you keep your weight up. They can also help you better manage your illness and the side effects of treatment. /r/n/r/n You may feel side effects of your first chemo treatment in the hours after your session. Most are temporary, but plan on resting so your body can begin the recovery process. /r/n/r/n Chemo treatment side effects, some of which you may experience after your first treatment, others not until several sessions, can include /r/n/r/n If you feel mentally foggy from the medications, let your healthcare provider know. /r/n/r/n before each round of chemo, you will have a blood test called a complete blood count, CBC. This is done to get the levels of blood cells produced by the bone marrow that can be affected by chemotherapy. /r/n/r/n tests are a normal part of the entire chemo process, and results give your healthcare team important information about your health status. /r/n/r/n for example, /r/n/r/n depending on your results, your oncologist may recommend delaying chemotherapy or using specific treatments to improve your values before starting. /r/n/r/n results also factor in calculating the strength of your chemo doses. /r/n/r/n you may need to take post-chemo medications. If you can, have those prescriptions filled before your first chemo session to ensure you have them when you need them. /r/n/r/n medications used to control nausea and vomiting differ. Some are taken on a schedule to prevent chemotherapy-induced nausea. To be most effective, take these medications before you feel sick. /r/n/r/n other nausea medications are used on an as-needed basis when you are already feeling nauseous or vomiting. /r/n/r/n make sure you get clear instructions on how and when to take your medications. /r/n/r/n avoiding infections is extremely important after you've had chemotherapy. Chemotherapy weakens your immune system. Your body will have a harder time fighting off infections after treatment. /r/n/r/n it is important to take extra precautions while you're undergoing chemotherapy to avoid the risk of infection. Some of these precautions include /r/n/r/n following these 8 tips throughout your chemotherapy process can help prevent many treatment-related issues. Always discuss any new or worsening symptoms promptly with your healthcare provider. /r/n/r/n additionally, keep track of any remedies that help your symptoms, for example, using a prescribed anti-nausea medication, taking time to rest, or drinking extra fluids. Such a list can come in handy later if you experience the same issue after a future treatment. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.